Here's a detailed version of each point for chromosome analysis, conventional cytogenetics. 1. Introduction. Chromosome analysis, also known as conventional cytogenetics or karyotyping, is a diagnostic laboratory technique used to visualize the number and structure of chromosomes in a person's cells. Since chromosomes carry genetic material DNA, abnormalities in their number or structure can lead to developmental delays, congenital anomalies, infertility, or cancers. This test plays a pivotal role in diagnosing genetic syndromes, prenatal anomalies, hematologic malignancies, and reproductive problems. Definition. Chromosome analysis is a test that examines an individual's chromosomes to identify any numerical, e.g., extra or missing chromosomes, or structural, e.g., translocations, deletions, duplications, inversions, abnormalities. The test involves culturing dividing cells, arresting them during metaphase, when chromosomes are most visible, staining them, and then evaluating their appearance under a microscope to construct a karyotype, an ordered display of all chromosomes. 3. Indications. Chromosome analysis is indicated in the following scenarios. Prenatal diagnosis. Advanced maternal age, 35 years, abnormal ultrasound findings. Positive results from non-invasive prenatal testing, NIPT. History of miscarriage or stillbirth. Pediatric disorders, developmental delays, intellectual disability, dysmorphic facial features, congenital anomalies. Reproductive issues. Infertility, recurrent pregnancy loss, suspected disorders of sexual development. Cancer diagnosis, leukemia, e.g. CML with Philadelphia chromosome, lymphoma, solid tumors. Others, family history of genetic conditions, ambiguous genitalia, short stature of unknown cause. Used for. Chromosome analysis is used to diagnose congenital genetic disorders, evaluate chromosomal abnormalities in cancer, e.g. translocations in leukemia, prognosis and treatment in oncology, screen fetuses for chromosomal syndromes, investigate causes of infertility and miscarriages, aid in genetic counseling. Why do need of this test? The test is needed to confirm a suspected genetic syndrome, detect chromosomal rearrangements that can be inherited, provide risk assessment for future offspring, determine prognosis and targeted treatment for cancer patients, support reproductive decision-making, rule out or confirm causes of growth abnormalities, ambiguous genitalia, and developmental delays. Hammer 6. What happens during the test? Step-by-step process. A. Sample collection, blood, most common, collected in a heparin tube, bone marrow for hematological cancers, amniotic fluid via amniocentesis, chorionic villus sampling, CVS, in early pregnancy, skin or other tissue biopsy in rare cases. B. Cell culture. Collected cells are cultured for 24 to 72 hours to promote cell division. C. Arrest in metaphase. A mitotic inhibitor, e.g. colchicine, is added to stop cells in metaphase, where chromosomes are condensed and visible. D. Chromosome preparation. Cells are harvested, lysed, and dropped onto slides to spread chromosomes. E. Staining and banding. Chromosomes are stained using Giemsa stain, G-banding, revealing banding patterns. F. Analysis. A microscope or imaging software is used to examine at least 20 metaphases. A karyotype is prepared and analyzed for abnormalities. 7. How long for my results? Peripheral blood, 7 to 14 days. Bone marrow, 5 to 10 days. Amniotic fluid, chorionic villus sampling, 10 to 14 days. Urgent leukemia or lymphoma cases. Preliminary results in 48 to 72 hours. Final in 7 to 10 days. 8. Prepare for this test. Preparation guidelines. No fasting or dietary restrictions. Inform your doctor if you're taking chemotherapy, radiation, or immunosuppressive drugs. May affect cell division. Prenatal testing may involve more invasive procedures, e.g. amniocentesis, which require consent and guidance from your healthcare provider. 9. Risks. Minimal, from blood draw, mild pain, bruising, or swelling. Infection at the puncture site, rare. Prenatal testing rhicentesis, slight risk of miscarriage, 0.1 to 0.3%. Chorionic villus sampling, similar or slightly higher risk, discomfort or cramping after procedures. 10. Normal values. A normal result shows 46 chromosomes, including 22 pairs of autosomes, 1 pair of sex chromosomes, female, 46X, male, no structural abnormalities, no extra or missing chromosomes. 11. Interpretation of results. Normal karyotype, 46XX or 46XY with no abnormalities. Abnormal karyotype, numerical anomalies. Trisomy 21, 47XX plus 21, Down syndrome. Monosomy X, 45X, Turner syndrome. Klinefelter syndrome, 47XXY. Structural anomalies, translocation EGT922, Q34 in chronic myeloid leukemia, deletion, e.g. 5P, Cry-Du-Chat syndrome, inversion, duplication ring chromosomes. Results must be interpreted by genetic specialists in the clinical context of the patient. #12. Factors affecting results. Poor cell growth due to improper sample storage or collection. Mosaicism. Abnormality may not be present in all cells. Contaminated sample. Recent radiation chemotherapy may suppress cell division. Sample type and timing, e.g. prenatal samples need optimal gestational age. #13. Clinical significance. Guides diagnosis of genetic disorders, both inherited and de novo. Informs risk of recurrence in future pregnancies, helps in family planning and reproductive choices, plays a role in oncology, identifies chromosomal changes in cancer cells, guides targeted therapy and prognosis, facilitates early detection and intervention for developmental or growth disorders, enables genetic counseling for affected individuals and their families. 14. Know more. Advanced techniques beyond conventional cytogenetics. Fluorescence in situ hybridization detects specific DNA sequences and chromosomal abnormalities more quickly. Array CGH, comparative genomic hybridization, identifies microdeletions and duplications not visible by karyotyping. Next-generation sequencing offers gene-level mutation analysis. Limitations of chromosome analysis. Cannot detect point mutations or single gene disorders. Lower resolution compared to molecular cytogenetic tests. May miss submicroscopic abnormalities. 15. Conclusion. Chromosome analysis remains a foundational tool in the fields of medical genetics, prenatal diagnosis, oncology, and reproductive health. While newer molecular techniques provide higher resolution, conventional cytogenetics offers a comprehensive view of large-scale chromosomal alterations. It is essential for diagnosing syndromes, assessing cancer risk, managing infertility, and planning prenatal care. Understanding its role, procedure, and limitations is critical for effective clinical decision-making and patient care. Thank you. Have a nice day.